Hi everyone, I'm Dr. Shikha Garg. Today we'll discuss about office butt or gluteal amnesia or a kind of dead butt syndrome. What exactly does this mean? जब भी आप you're sitting for a long hours in a chair, long sitting in the offices, you could get symptoms of like numbness or tingling sensation in the butt or a pain which is shooting down to the leg, or there could be soreness or a pain in the local buttock area, or there could be lack of strength and tone in the buttocks. So all these symptoms, लोग बोलते हैं ना सुन्न हो गया when you're sitting for very prolonged time, that is called a gluteal amnesia, or we can also call it as office butt. It happens why? Because the gluteus muscle का group है, that muscle has been weakened because of the prolonged sitting. Blood circulation reduces to that area, which can lead to problems with your motility. Motility means chalna phirna. There could be back problems, backache also, and poor posture. So these could be the reasons also, and these could be the further indications also. So what other things can happen? There could be a posture issue. It might happen for a prolonged time. You might not be able to hold your posture properly because of the changes of the muscles. Apart from that, decline in the bone health would happen. There could happen a weight gain, or a varicose vein or DVT can happen, and neck and shoulder stiffness can also happen because of the nerves and the bony system, because of our spine system. So what you can do, how to prevent it? Get up every hour. Make sure you get up for a few minutes every hour. Just go get up, move around. That would be very good because blood circulation would be intact. Your posture will remain better. Your body will have a better motility. That is to motility means to walk around, right? So after every 30 to 60 minutes, at least for a few minutes, 1 2 3 4 5, go get a water or anything, right? So and also while you're moving, prefer staircase instead of elevators, or lifts or escalators. Prefer stairs, so that will also help keeping it moving. Apart from that, always set a posture alarm. So when you're sitting, like I'm slouching, always like focus on yourself and sit straight. You might not really feel it. After a while everybody tends to slouch, so you just have to consciously put yourself in that posture alarm. So after every like put an alarm after 5 minutes so that you see what posture you're sitting, right? So this is also happening to me. I'm also sitting, I'm also slouching. So this is a human tendency, right? Even being a doctor, so you have to be careful about it. When you start putting a posture alarm with a long time, your body and your mind will get trained about it, so you have to train it. So what is the right posture? So when you're keeping your back straight, aligned with the chair, right? And your feet are flat and knees are at 90 degrees, right? And your tilt hips toward slightly forward for a proper alignment. Instead of this, this is a better one. And when you're sitting, keep on, you can squeeze your glutes for a while so that it can move a bit. So when you are sitting, and you can keep your elbows right like at a 90 degrees. So basically you are sitting like a L, this shape. So this is your spine, this is your glute, and this is again your knee. And so another thing you can do is support your glutes at work. Put a pillow or a small cushion at the curve of the back or a curve of the hip, or our spine is usually S-shaped. So where there is a gap, you can put up the small cushions to support it so that it's straight and you can sit in a better posture. And always make sure you have a better good chair. It should be supporting, but it should not have a too much of cushions, because that will put a strain on your muscles and back, because you might not feel it for a long time, but that posture would be wrong, and in a long term it will make your muscles weak. There would be a problem of posture, there would be back pain, lower back pain radiating to the legs, everything will happen, and there could even be the cervical thing, which is very common in the office people, and lately even in every one, because we keep on holding our phone and just keep on looking for a long time, and that too not in a good posture. We are always in a very bad posture. And please never use your phone while you are lying down. Don't do that. And another thing, which is the best thing, is always to exercise. So your muscles are going great, your blood flow is doing very well, circulation is good, your muscles are strong. So exercise will keep everything in check. So it's very important to do that to prevent all this. If still you have this already and you cannot do it, visit your doctor. Start taking multivitamins specifically related to nerves or you can take gabapentin, but best is to get it prescribed from a doctor. Start taking that, and also start following the points which I just mentioned. Keep on moving after every 30 to 60 minutes. Maintain a good posture, hydrate yourself, and exercise well. Thank you.